So, starting in spring 2020, um, policymakers at the Division of Public Health contacted a number of leaders in the community and asked them to be part of a strategic planning process for school-based health centers in the state of Delaware. And this is a process that we just completed in the past week or two. And it's been a little bit more than a year-long process. I would say maybe something like a 16-month process, where we have essentially school-based health centers have been around for a long time in Delaware, but it's been a long time since folks have actually gotten together and looked at all of the major aspects that are required for school-based health centers to be successful, existing centers, and then also to look at what would be needed if school districts were interested in adding new centers. So among the things that have changed over the years is really the third-party reimbursement system by which school-based health centers get paid. So typically, school-based health centers get some money from the state or from a school district, and then they make up the difference between that money and their operating costs by billing third-party insurance. And as everyone I think knows, insurance has gotten a lot more complicated in the last number of years. So we really needed to look at ways that we could collaborate with insurance providers, private and insurance and Medicaid, to try to advocate for a system that would allow these existing centers to be able to stay open and to thrive. And so part of what the strategic plan was looking at is really all the operational aspects of a school-based wellness center, from the revenue side to data collection to kind of a basic menu of services that everybody can be clear that we're doing the same thing, to the idea of maintaining rigorous quality in terms of always doing things that are research-based, and then some of the kind of finer technical details about back office type things. But this strategic plan is put together, with all said and done, we have a steering committee of just over 20 people. And then we had work groups that probably totaled close to 100 people from all disciplines across the state, from insurance companies to private medical providers to public schools, to people in a variety of state agencies, to consumers. And it was really an interest in really getting as much information we could about how we're currently operating, where we'd like to go with this and how to get there, also with an eye to talking to school-based health organizations across the state at the national level and in other states to try to get an understanding of how they have addressed this. And it's really been a great public-private partnership to bring this together to get to where we are right now. And we've also worked in close collaboration with our legislators as well, state legislators and senators, and been liaised with the governor's office as well in this work.